Oh yeah, this is it. This is the crown royal. Not alcohol, food. Stay focused. New Year's is over. This is the new year, but the New Year's Day celebrations are over. Now we got to buckle on down. You know you just graduated. You know you got to pass this NCLEX. You know you want to get out and start working. You know you're probably already working as an aide, but you got to somehow figure out how to study for NCLEX. So this video is, ta-da, here it is, the new 2024 Ngn Nclex self-study schedule that will take the average student who just graduated from nursing school about 12 weeks. Now, let me say a few things about the 12 weeks. Number one, if you have applied and maybe even received your ATT, your authorization to test, no matter what state you are in, that state generally will give you anywhere from 6 months, which is average, to, if you're in Ohio or Pennsylvania, a whole year. Every now and then, it's very rare. Every now and then I see an ATT that expires in 3 months. And then I'm like, ew, don't even apply for your test yet. Wait a little bit. So one of the things that I've been trying to get people who are repeat test takers, which means they failed already, one of the things I keep trying to get them to do is not apply for that test 45 days later, because you're almost guaranteed to fail. Very few 45-day later test takers pass, and that's historical. I'll say it again because it's critical. Very few 45-day test taker students pass. You need longer than 45 days. If you failed the test before, you need at least on average, because some people beat that. I had a girl come in here in 4 weeks and knock it out. She had failed one time only, but she did. She came in and 4 weeks later, she was gone. I would say maybe 5 weeks later, if we don't count the, the first week. But yeah, 5 weeks later, she was gone. Now that's rare, but if you have failed the test before, you're gonna need about 4 to 5 months. People in Cleveland, Ohio know that I'm the only one in the world who lets you stay in the class for 5 months, because I get it. I know it takes a while for some students, but average should be 8 to 12 weeks. So this schedule that I prepared for you is 12 weeks. Now, you're not going to be no 12-week person if you failed that test in 85 questions, because you killed everybody and they cannot be revived. Even 45 days later, they can't be revived. 6 weeks later, no. 12 weeks later, they still dead. You got a lot to learn. If you looked at your candidate report and you got more than 2 belows on it, you are not the 12-week person. You need more time. If you graduated more than a couple of years ago, you need more time. If you weren't born in the United States and you're considered to be an English second language or international student, you need more time. I hope I'm making myself clear so you're not like, in a fog thinking this applies to 100% of everybody. No, it doesn't. This is the traditional new graduate within 30 days of graduation who decides to buckle down instead of go on vacation for weeks, who decides to buckle down and knock this out so they can get busy with their nursing career. So let's show you how it's done, shall we? Here we go. The first thing you're going to do today is you're going to visit the HETV the HETV YouTube channel, and you're gonna have to get good at finding the playlist. You just got to get good at it, okay? So I'm gonna stick this phone really close up, and I'm going to get out of there, and I'm going to go to the app on my phone. Some of you don't even have the app on your phone, which is a problem. I'm going to go ahead in this app, and I'm going down to the little button that says subscriptions. And then you're going to see up at the top, HETV, and there's my silly little look right there. And then you should have something that says view channel, and the key is always to get to playlist. Okay, so if you get to the playlist and your playlist says management of care today, because it can change when I add more videos, the top playlist may change. If you did all of that right, that's exactly how it should look. And then you are going to, here we go, you're going to scroll up, 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 up. There you go. This picture will never change. It will always say Ngn Nclex self-study tips and guidance. There you go. So look at this. What I am telling you to do today, like right now, today. You don't have time to waste. You got to get it together. Here we go. Visit HETV. That's what we just did. We went to the playlist. You saw us do that. You have to watch the first 5 videos only. You don't need any more. They're short and sweet, but they're there. The 5 videos include the step-by-step guidelines, which are pretty much going to help you figure out how to do this as well. The part 1, part 2, and part 3, how to study. You'll see them. And then the last one in the series is the Oh My God packet, if you were smart enough to buy the Oh My God packet. If you weren't, who cares? Don't worry about it. Just do the 4. Okay, so that's the very first thing that you're going to do. Now, I don't know when you want to start this. If you want to start this tomorrow, or you want to start it on Monday, or you want to start it on a Saturday, I don't care. But whatever you do, get you a calendar and literally mark it out. Week 1, week 2, week 3, and then put the subjects you're supposed to master. We use a mastery approach here, and mastery simply means tackling a subject one at a time. You beat the shit out of it until no matter what they ask you in that subject, you could handle the business and get that answer right, because you know that subject so well that you are prepared for anything they bring to you on this NCLEX. Let me show you what subjects to master first. By the way, this is very strategic the way I do it. Don't get it twisted. I've thought it through. The good news, if you forget and don't remember shit I'm saying, it's all in the Oh My God packet. All right. So with week 1, you buy your UWorld. I don't care if you're an LPN. You need to buy UWorld RN. Don't mess that up. The LPN version is not hard enough. It ain't got the EKGs. You got to do what you got to do. Then you're going to take, this is very important, listen to me. You're going to take that very first assessment test in the UWorld software. It's going to be called Take NCLEX RN Test 1. It is an assessment test. And you know, if you're my online student, you always send me that score. The questions in that test, there's 100 of them. Be prepared for that. Don't click on that shit and think you're about to whiz on through and get to work. No, you got to take this on a day when you can truly commit to doing your best. And it's just a pre-assessment. I'm going to say that again. It's a pre-assessment. It is to tell you where you are right now and how much work you might have in front of you. That pre-assessment exam is going to give you some insight as to whether or not you need longer than 12 weeks or you're right on target and maybe even get done sooner. All right, okay. That's critical. A lot of students don't do that. I'm trying to help you guys today. This new year is here. I've learned a lot about this new test. I need y'all to do that pre-assessment to find out where you are. Okay. Now, that same week, oh, you ain't done, boo. That same week, by the way, when you do that pre-assessment test, don't even bother with the rationales because you don't have time. But that same week, week 1, we're still in week 1, you are starting your mastery process that I've talked to you about till I'm blue in the face. The mastery process is to start with one subject at a time. We always start with psych and psych meds. You put the two together on your UWorld software, and when you go to watch the videos, you will see on my playlist when you go to the playlist and you scroll and scroll and scroll, you got to scroll a while because I have over 400 videos. When you scroll down the playlist, you're looking for, of course, the psych playlist. When you find it, you will see I put the medications in there as well as the conditions, okay? If you went to pharmacology playlist, you'll also see psych meds. So there's a duplication there for you in case you forget, all right? So you pull up that psych and psych meds. Look at this. That's the only subject. No other subjects. No other subjects. The way the pattern or system goes, because this is a very systematic approach to the NCLEX. The way the system goes is you look at the handout. If you've purchased our self-study program, you look at the handout, in this case, psych and psych meds, 2 handouts. You look in there to see what's going to be covered on this video, just to be really just to be familiar with the packets, so that when you start the video and you start watching it, you say, oh, I know there's a handout on that. Let me turn to that. This is way better than notebook paper, way more effective, and a whole lot faster. So if you're talking about fast, the handouts are the way to go. We have every single handout for every single playlist. So there's not a playlist in the category. There's not a playlist on my HETV YouTube that doesn't have a handout with it. Playlists have handouts. Okay. Now, so if you're looking at the handout to familiarize yourself with what's in the handout, so you're not going and scrambling all around trying to figure out, do I have a handout in that? You would know that once you start the video is going to start yap, yap, yapping. And when I say something that the handout has on it already, you are highlighting the shit out of that, right? Sometimes I'll even say select all, then you know, S-A-T-A, right? S-A-T-A, select all that apply needs to be put on that handout. You are using colored pens to write medications if you need to on that handout. So you're watching the video, basically taking notes on the handout. The next thing you're doing is after you watch one video, not all 10, no, one video, you're going to go over to UWorld, and like I told you earlier, only do small numbers of tests. You can do 30 tests in one day, but the test itself can't have any more than 25 questions in it. And if I keep it all the way 100, I only do 5. Yeah, 5 is so easy to manage and learn and understand. So handout, video, 5 questions, you're not done. Then the rationales, not just the rationales in the questions you missed. No, every rationale, because you and I both know sometimes you'll get a question right and you kind of guessed. So there you go. Handout, video, questions, rationales. That's the system. Now watch this. You're still in week 1. Once you do your psych, you are adding, not to psych, but after you've done your psych. And what does done mean? Okay, let me back it up. What does done with psych mean? It means that when you did your 5 to 25 questions in psych all day, every single day, all day. I mean, for real, you beat it up. Once you get that, what, 85% for some of you, 80% for others. New grads are 80s. People who are repeat test taker are 85. If you're LPN, brand new LPN, never took the test before in her life, 70. If it's a repeat test, 75. So what you're doing when you get that score that you need, you're stopping right there. Here's what you're thinking about. The 5 to 25 that you were doing all day, every day on the same subject, those were quizzes. Now you need the final. You're done with that. Now you got to do 85 questions in psych as a final exam to see if you really know it and still get 85%. So that's what this is saying. So let's look at what we're doing week 1. We bought the UWorld, we took the pre-assessment, we started with psych. When we got done with psych with an 85% in the 5 to 25, we did 85 questions in psych, boom. You're still trying to get that 85. Let's say you don't get that 85%. Well, you ain't mastered shit. You got to stay there, boo. Go back to your 5 to 25. Go back to your videos. Really try your best to get that 85. If you're really looking at the videos, you'll get the 85. In that same week, you're adding another subject. Renal and reproductive are together. They're together because renal has videos, reproductive has a few, but reproductive is a separate category on UWorld, and then renal is genital urinary or something like that. You're putting those two together. The same way on UWorld you put mental health and psych meds together for your first subject to start with. So here you are in the same week. Renal and reproductive, 80 to 85% you're trying to get. We already said that. Once you get that score with your 5 to 25, you move on ahead and do 85 of renal and reproductive together. If you get the 85%, move on. Now, let me say this. If you work a lot, if you have children, if you are taking care of mom, if you are in school now, which is crazy, but you know, this is all the shit I see. If you failed before, if you went to a shitty school, if you graduated a long time ago, if you're born outside the United States, if whatever, if any of those things are happening, you are not going to get out of psych in that first week. Oh no, it might take you 3 weeks to get out of psych. Yeah. That's the key. But I am giving you the traditional new graduate student who went to a decent school and is just needing a little bit of a refresher, not to be taught nursing school all over again. That's why you're very individualized in who you are on this test. Okay, let's look at week 2. Week 2 is here. You're going to do the same thing, but what subjects do you do on week 2? If you've mastered renal, reproductive, and psych in week 1, you are now on respiratory, and you will see very easily on the UWorld that cancer and hematology are one subject on the UWorld, and you always add immunology for some HIV questions because immunology, hematology, and cancer, let me say that again. Cancer, hematology, immunology, they're very much overlapping and related, which is why you need a system so that you know that. Coming out of school, I don't know that I would have known that. That's why you have us experts in the field out here trying to help you. Again, don't forget I said it. Cancer, hematology, immunology, they're all related. They overlap so much. So you're going to put all 3 of those together in one test. But of course, respiratory is by itself. I kind of showed you that with the way I did the colors on the board. If you look up here, psych and psych meds, 1 color. Renal, repro, 1 color. Cancer, hematology, immunology, 1 color. They go together. Okay, so that's week 2. On week 3 is a big one. It can also take you a little longer than maybe week 2 did. Week 3 is GI, and GI takes the longest, except for procedures, which are really ridiculous. But GI can take the longest. It's the most amount of questions on UWorld. It has 2 different video playlists, chronic and acute. It is the source of regular questions and a lot of case studies. So you kind of gotta really know your GI. So you see here, Master GI. Once you get done with that, knowing it could take a little longer, you want to throw ortho, which is attached to integumentary. Those two go together. So when you think of integumentary, think of burns, think of wounds, think of that sort of thing. But it goes with ortho because if you break a leg, break a hip, fracture a knee, you probably screwed the skin up as well. Integumentary is skin. They go together, keep them together. All right. Now, week 5, what are you doing? Well, you got a lot to do, but it will be easier and easier. The more questions you do, the more exposure you get to the videos, the more concepts you're learning. These mastery weeks will go a little easier. And this mastery week is very important. This is where you are trying to master procedures, which is the #1 area of failure on the new Ngn Nclex. It's the reduction of risk. So you're trying to master that, and it's not that easy. You are also remembering that there's a video on the basic care and comfort category, which is tied with reduction of risk for the #1 failure area. You're remembering that I did a really good video on this for you so that you know what basic care and comfort is. And you're remembering that part of procedures and reduction of risk is your EKGs. And if you already have it, you will be fine, you know, the EKG pink packet. If you don't, you didn't need it. I'm on the video showing you the strip. So don't get too crazy. All right. Now, so that was week 5. Week 6 and 7. Notice I said and. Weeks 6 and 7 is all specialty areas. What kind of specialty areas? Maternity, growth and development, pediatrics, and geriatrics. Now, of course, we have a handout for every single one of these, and the handouts for this are available as well in our link. And then you're making sure you do your case studies, which are videos available. We use Grey's Anatomy in our class to do case studies. It's really fun. You won't suffer much. You don't have to study them as hard. One of the things we figured out is that you guys love case studies, plus you get partial credit. And so your case studies are the least of your problems. Don't study math and don't linger with case studies. Give case studies enough where you actually learned it, but then stop. We studied that too much. That's what we learned in the updates that I told you about in the last video. I gave you the updates that I've learned. One of the things I've learned is that the only time you get aboves is in them case studies. I done seen more aboves in case studies, and it used to be you never saw aboves on anybody's candidate report. Now I see a ton of them on the case studies. So don't go crazy with case studies. Please don't. UWorld has enough. You're going to be fine. Okay, come on. Weeks 8, 9, and 10. So weeks 8 through 10, you are not, oh, by the way, oh my God, I can't believe I said this. I didn't say this. Listen to me, please. Let me go back to weeks 6 and 7, the maternity, the geriatrics, the pediatrics, the growth and development. This is not a mastery situation. All the other categories above that were mastery. Look what I wrote. Study, not master. Maternity, G&D, growth and development, pediatrics, and geriatrics. You don't need to get 80s and 85% in that. Don't linger on that. You are definitely watching videos and you are absolutely doing the questions, but you are not striving for 80, 85% on specialty areas like that. So don't sweat it, okay? All right? Okay. Now, weeks 8 through 10 are the same way. You are studying them, but you are not mastering cardio. I know that comes as a shock, but stay with me. Cardio, acid, base, and electrolytes, which is all one packet and a ton of videos. And then infectious diseases. Don't forget that infectious diseases are added. They've added a lot more infectious diseases to the NCLEX, the Ngn Nclex, than they did before, because you guys were fucking up COVID, just stupid about it. And so they're like, oh, clearly our nurses don't know what the fuck they're doing, so we're going to add more infectious diseases. And so that's here. All right. Now, the last couple of weeks, weeks 11 and 12. Study, but don't master. Master is the 80-85%. Study, but no need to master. Here we go. Pharmacology, which you already know there's more of, and management of care. Now, here we go. When it comes to management of care, you know that's your prioritization, your delegation, your workplace conflict, your ethical legal, your SBAR, your nursing, electronics, all that stuff is in here. Your therapeutic communication, non-therapeutic communication, that's your management of care. And when it comes to medications, oh, you already know how we do it. You got like 3 packets basically of medications. And it's like so ridiculous because why? What did we say? They put more of these on the test than they've ever had. And I am a witness. I have seen it. Students have a shitload of meds on this test. So closer to the day of your test, you're doing this whole pharmacology thing. Now, be careful, people. Do not sleep the fact that the Oh My God packet is the summary of all of this. What do I mean by that? Well, just the fact that all of your who you see first in terms of prioritization and who you should be trying to see first is actually on page 6 called the NCLEX Quickie. So you have who is your priority or who you see first. You have who you shouldn't see first. You have who should we delegate to the float nurses. You have all of that there. Then if you look at page 7, you even have all the conditions that have been on the NCLEX exam as people that you saw first. And then when you look at this Oh My God packet, which is worth its weight in gold, you will see not only did I put it in the NCLEX Quickie, but I explained it on page 8. There you go. There is prioritization, there is delegation, there is your immunosuppressant patients, your infectious diseases, your seizure precaution type things to know. I mean, then on page 9, I gave you labs. And let me say this, there is another good news on the labs. This Ngn Nclex gives you the labs and the normals. Isn't that nice? I still put them in here because if you work at my job, the Cleveland Clinic, your ass got to know your labs. They don't give you no normals. You just got to be clueless. I mean, you got to have a clue about your damn labs. Now, here we go, y'all. Yes, we did include some select alls. So if you look at these are all of your shocks. Okay, I'll get a little closer. These are all of your shocks, all of your respiratory distress signs and symptoms, all of your neuro distress, your anaphylaxis, your cardio, sepsis, okay? Then if you look at page 11 of the Oh My God packet, all your precautions are here. Bleeding, neutropenic, you have your ICP, your seizures, all of that, dysphagia, suicidal precautions, everything. You turn the page and we have your pediatric and maternity quickies. Little quick things, because this is what you read right before you get out the car to take your test. And you look at this the whole week before as well. There you go with your pharmacology, or not pharmacology, my bad. Your nutrition and different diets. That's all in your Oh My God packet. I mean, the Oh My God packet has a lot of shit in it, okay? Then you turn and you have your ethical legal. This is all Oh My God packet. Cultures and religions. Yes, you have to know that. We cannot deport everybody and their mama-in-law. They're here, thank God. Pharmacology tips. There you go. Boom. You're going to love that page. I swear to God. Some of you asked me for this, and it was in your packet all along. Test-taking strategies. What's a test-taking strategy? Don't study no math. That's number 1. Okay? So Stop changing your damn answer. That's number 2. I mean, you know, I got all this in here, okay? Then you have your a day in the week of a student in a week of a class here. What that means is that if you look at this, it's what is a typical week like for 99% of the students that take my class. It even gives you the day of the week, what to do that day, the next day of the week, Thursday, what to do that day. You turn the page, you got your Friday, your Saturday, your Sunday, all of that is right there, okay? Now, I give you the next generation NCLEX Ngn tips. I tell you when it started, what you have to know, what types of questions you're going to get, all of that, okay? All right. Now, I really like this. This is the Ngn case studies and how to approach the case studies. All the case study hookup right there. And of course, everything I just said on the board. That's your schedule. That's what's on this board. So again, that's why I said the Oh My God packet is your study guide. Now, I'm done. I hope this helped giving you a schedule of how to do what you do. All those packets that you just seen me show you, there was a total of 8 of those. If you're interested in any of those, you're not going to believe this, but you can pick 6 for $66. That's pretty fucking great. 6 for $66. And you pick them. Pick 6 for $66. Pick 6 for $66. Woohoo! Pick 6 for $66. Deuces, I'm getting crazy, a little loopy. Gotta go home, tired. Ooh.